Jadi hari ini kita akan berjumpa dengan dua pakar ortodontik dan kita akan tunjukkan pada mereka video fake braces. Nak tahu apa reaksi mereka? Jom ikut saya.
My name is Dr. Tan. I'm the specialist orthodontist at Klinik Pergigian Jalan Gambut, Kuantan.
Hi, I'm Dr. Sindhuja Rajadorai. I'm currently a pakar-pakar clinical in orthodontics. I'm working at Klinik Pergigian Jalan Gambut under the Ministry of Health, Malaysia.
Okay, I've been asked to look at the video, and I've been told it's a video of a fake dentist doing a treatment with braces. Okay, so I'm going to start the video. The first part of the video shows the person. I don't know who is the person, but he's actually using a light, and the light is actually used to cure, or to harden the braces, to stick the braces onto the teeth, and doesn't seem to be using the light in a proper manner. He's going too quickly from left to right. That may cause the braces not to stick properly to the teeth.
So from this clip that I just watched, I can see that the light cure process that's being carried out by this so-called this fake dentist is very, very fast, running over the teeth and taking too little time. And each tooth actually needs at least 20 seconds. And if you're not doing this, it can lead to the braces actually falling off your teeth. Here, immediately, the first thing that jumps out is this person is actually carrying out treatment in the mouth of a patient, and she's got no gloves whatsoever on her hands, and this is obviously very, very poor infection control. The patient doesn't have any protection against the person who's carrying out treatment.
The video, this part of the video seems to show somebody doing some sort of dental treatment in a house. So from this, we already know that that's not a real dentist. There's no real dentist actually does any kind of treatment in anybody's home. It must be in a real clinic. Moving on, still on further. Apparently there's entertainment as well, somebody playing the guitar. So yeah, that's definitely not a dental clinic.
Again, here, treatment is being carried out in the home environment with the patient lying down, seems to me to be lying down on the floor. And the person is working in the patient's mouth, again without gloves. There are people around, and there's a guy who's actually playing music. This is very distracting for the person who's carrying out treatment, and also the patient is not in an ideal position. There's not enough light to see what you're doing. Things can go wrong, and you don't have enough access to get in. There's no moisture control. Ultimately, all of this adds up to the brackets probably fading or tooth movement going in the wrong direction, and this does not work out in the best interest of the patient. Okay, so here she's showing us her stock of orthodontic equipment that she's got. She's got on some colored nails, which is a big no-no in infection control, and she seems to be having these instruments in some boxes in her home. They are not sealed and packed, indicating that it's probably not sterilized. And unsterilized instruments used between patients poses a risk for patients in terms of infection control again.
And from these cases, from these pictures, you already can see that this is not a real orthodontist, because the real orthodontist will never place the brace in the way that has been placed.
Okay, so what I can see here is fixed braces on the top and bottom teeth. And the top teeth, they look a little bit strange. This is not usually what we carry out. I can see that the wire looks very thin, and there seems to be quite a lot of elastic running on the teeth, which is not standard practice, and this can lead to teeth moving uncontrollably, and poor treatment outcome in the end. Even the method of the wire being tied in seems to be a bit strange and not conventional at all.
Some of the placement of the braces are not correct, which may cause the teeth to move in ways that we don't want it to move, that may cause some damage to the teeth. And yeah, and the last picture shows again some sort of brace that has been placed on the teeth with rubber bands that will never ever be used on any real patient. Okay, it looks like a fashion accessory rather than actually real elastics that are used for treatment.
What is your actual reaction to this? You rasa terkilan ke, or you rasa disappointed ke?
Well, it's actually a mixed feeling of everything. Okay, yeah, a little bit disappointed that these things are happening. Okay, a little bit worried because I worry for the patients that are having treatment. Okay, you don't know what's going to happen to their teeth and their general health, because certain things that it may. Alright, if treatment is not done cleanly, then it can cause some things like infections and things like that. And of course, being a professional, I can't help being a little bit maybe upset, okay, if not angry, okay, because some people are being taken advantage of, perhaps. So a little bit of a mixed bag of emotions.
Apakah beza braces yang digunakan oleh pakar dengan braces yang digunakan oleh pemasang braces di media sosial?
Okay, so based on what I've seen on social media and also what I've seen in clinical practice, the brace on each tooth that's used for patients who have these fake braces outside is exactly the same, which is not what we do. We have individual braces for each tooth to get them into the right position. The ultimate aim of treatment, I think, cannot be achieved if you're not using them in the right way. The other difference between what specialists use is the suppliers who supply us the brace. They are licensed suppliers, and they're in the business of selling orthodontic supplies. Whereas these people on social media, I obviously don't know where they get their supplies from.
Sepanjang Doktor berkhidmat,
Yep.
pernah tak ada pesakit fake braces yang datang pada doktor minta dibuangkan braces tu ke, atau any other patients that ask for your help because of it?
Pernah, sudah tentu pernah. Dan yang kes yang kami tengok pun kadang-kadang ialah kes yang telah kemudaratan telah berlaku. Okey, itu satu. Okey, dan ada kes yang lain, dia datang kepada kami sebab dia tak boleh cari dah orang yang memasang braces tu. Orang yang datang untuk pasang, tidak dapat dihubungi lagi. Dan dia tak tahu mana nak pergi untuk menanggalkan braces tu. So antara kes-kes yang saya pernah tengok.
Kebanyakan pemasang braces dekat media sosial ni, dia belajar cara pasang tu dekat YouTube. Okay? Dan mungkin ambil masa dalam sehari, seminggu, or even a month, probably so. So, for a doctor, how long does it take to become an orthodontist?
That's very painful to hear because it takes such a long time, a lot of hard work and a lot of dedication to become a qualified orthodontist. You need 5 years of dental training and a further 3 to 4 years on top of that to become a qualified person. So when someone else is out there doing treatment which is undesirable and causing harm to the patients, people like us do want to change things, basically.
So, kena jadi Doktor Gigi dulu. So, itu pun sudah akan mengambil masa tempohnya 5 tahun untuk menjadi Doktor Gigi biasa. Selepas menjadi Doktor Gigi biasa, kena biasa mendapat pengalaman yang secara am dulu sebagai Doktor Gigi. Itu pun paling kurang pun biasanya 2-3 tahun. Sebelum masuk untuk mengkhusus untuk membuat pendakian gigi, yang mengambil masa 3 hingga 4 tahun lagi. So, secara keseluruhannya untuk menjadi seorang pakar ortodontik, pakar pendakian gigi, akan mengambil masa 10 hingga 12 tahun.
Okay, last question, Doctor. What is your advice for the public out there, and or whoever who considers to use fake braces instead of real braces done by professionals?
Okay. There is a lot of information available on the internet, and the internet is very accessible to all of us. When you go onto the internet, you've also got to be careful with what you read, because there's lots of material out there. Ultimately, if you're not sure, you can seek professional advice. You can come in and get a consultation from us. Know what your options are, what the risks are, what the benefits are. Sometimes cheaper isn't always better, and investing a bit of money for long-term health and for long-term satisfaction is probably worth your while. So do come in, see us and ask.
So, korang dah faham kan apa kesan fake braces? Tanya diri sendiri, apa nilai sebenar gigi kita ni? Jadilah pengguna yang bijak. Doktor Gigi, pastikan yang ORI.